brief. It's an honor for me to be here. Thank you so much, Dr. Hood, for the invitation, and Elizabeth. It's been an honor for me to serve as the Health Equity Officer in the state of California within the Public Health Department. I've been in this role for just over 2 years, and we are doing some awesome things, all of which I will not talk about tonight, but our staff has grown from about 16 to 17 staff to having about 38 staff now, and we have two-thirds of those positions that are filled, and we're still staffing up. We have a $70 million budget, and the office was created 3 years ago. I give you that context and information to demonstrate that that's an initial and very substantive commitment within the state of California, even though we can and will do more as far as demonstrating our commitment to achieving health and mental health equity, and I'm honored to be able to lead the offices in the state's charge around achieving health and mental health equity. A part of our mandate is literally to help change government in a very transcendent way. And literally about 2 to 3 weeks ago, I read The Gardener's Tale. I was at the W Hotel here in San Diego, drinking a good glass of bourbon and reading the 4 pages of the framework. And I read it again because the bourbon got that good to me. And it resonated so deeply with me, but particularly on the last page when you ask the question, rhetorically but literally also, who's the gardener? And I reflected on myself because I'm working within a major institution, government, that has a significant role in how we shape infrastructure. That has to do with policy, budget, allocation, how we work across the branches of executive, legislative, judicial branches of government, and also from our Health and All Policies approach. We have our Health and All Policies Task Force within the state of California, and that team is staffed out of my Office of Health Equity. And I'm delighted that the American Public Health Association, their conference a few weeks ago, centered around a Health and All Policies approach where we work with 22 different departments, offices, and agencies across government to really go upstream in educating them proactively about how you think about health equity when you create policy and make budgetary decisions in the spaces of social services, in the spaces of transportation, land use, education, so on and so forth. So we are actively engaged just over 5 years now that Health and All Policies work has been underway. From one governor's administration and the Schwarzenegger administration has been accelerated and strengthened in the Brown administration, and we're great to be doing that work to transcend and to literally change in a way that government hasn't really seen before. And the reality of it is that because we didn't get here overnight, we should all be committed to an effort that affects change that exceeds our tenure. A lot of times people come to me after being 2 years on the job, what effect have you had? And we can articulate some effects. But we know if we're focused upstream on the right issues and that we sustain this work, then we're not truly going to see the results until I'm out of my appointed position and we have leadership that comes behind me and we cultivate this pipeline to address this disconnect that I've noted here, this disconnect around if we need to change institutions and systems, then there's a huge disconnect that we have in this state where we have 38 million people. The browning and tanning effect, to use Steve Stout's language, is very real in this country and in this state. But the disconnect is that many of those who represent leadership in our government institutions and even in the private sector don't reflect the demographics of this state. And why is that? There's a statistic from the Department of Education when we think about going upstream, not only in systems but in the life course. The Department of Education notes, their Civil Rights Division, that 18% of our preschoolers across the country are African-American boys and girls. Good to see you, by the way. But 48% of the one-day school suspensions in preschool are our African-American boys and girls. Think about that. So when we think about this disconnect around who's not being represented at the leadership levels in the workforce, and we think about the need to not only train and develop an intellectually diverse workforce, but the need to realistically brown and tan the workforce, if it starts that early in our systems and our children are being redirected from being on a path of academic excellence into our juvenile justice systems, then we have an issue with the pipeline being stifled. And we've got to think more comprehensively, which we are doing and working closely with the Department of Education, on how we rid ourselves of many of these social inequalities that we see in our system. I had the good fortune of going to Columbia University, an Ivy League school, and USC for graduate school. Got my master's in healthcare administration. In third grade, just to give you an illustration of what it looks like, in third grade, I had a teacher, Mr. Young, never forget him. He called me a dumb fool. And it resonates, obviously, because I think about it to this day. I know that that's not true. But Bill and Yvonne, my mom and dad, were at school the next day, and they took care of that issue and had a nice conversation with the administration and the school and with the teacher. I use that as a practical example of how, when we think about kind of structural violence and how with our kids, the language that we use to either break down or build up our children is so important. And I thank God for the resilience and being in the position that I have now to be able to internalize the realities of discrimination and racism, but to be in a position to constructively affect change in the highest places of government in the state of California. One last thing I want to leave with you is I love to hear Dr. Iden talk. He always talks about that power piece. And power is so important when we think about how we need to activate our communities to not only mobilize, as Dr. Jones talked about, but to get out and to vote. Why is that important when we think about this within the context of health and mental health inequities? Dr. Javier Rodriguez from the University of Michigan did a Black Lives Matter study on the effect of preventable African American deaths due to health disparities and the effect that it had on the 2004 Bush-Kerry electorate. So this study looked at preventable deaths in the African American community across the country from 1970 to 2004. They projected that roughly 2 million African Americans died during that 34-year time frame. If in 2004 those 2 million people had still been around working, contributing to our economy, but more importantly, voting on who they want to represent them on a local, state, and on a national level, projected that 1.7 million of those 2 million would have been at voting age. In 2004, as a result of them still exercising their civil rights to be engaged, President Bush would have gotten 100,000 more votes. Senator John Kerry would have gotten 900,000 more votes from the African American community. Why is political engagement so important? Because particularly in our culture as the gardener, many of the major social services, health and human services, resources, and decisions are allocated where? In government. But if we are dying off, if our quality of life is very, very poor, the last thing we're thinking about is going to vote. And due to systemic disenfranchisement of our community, we have to think about those non-health related but very important determinants of equity around activating our people to get active, to mobilize, to ensure that we have representation, that we ensure that our kids from an early childhood development perspective are being cultivated towards academic excellence so we can build in systemic change to where we see the browning and tanning effect demographically represented in private, public sector, and I think that's one of the most upstream dynamics that I want to leave with you today. Honored to have been able to share with you, and thank you.